Most of you are feeling exhausted right now, and it's not your fault. There's a hormone inside your body pumping through your veins every single day that decides whether you feel energized or completely drained. And I'm going to show you exactly what it is, what triggers it, and how to finally take control of it. Imagine waking up groggy, reaching for your phone, and feeling the weight of the day before you even get out of bed. Why do some days feel like a battle while others are a breeze? What if the secret is a molecule surging inside you every morning, the stress hormone called cortisol? I'm Dr. Zaid Fadul, and today we're breaking down cortisol, the hormone scientists call the conductor of your body's stress orchestra. We'll reveal how it affects your mind, your mood, your metabolism, and even the shape of your waistline. If you want to understand why acute stress makes you sharp and alert, why chronic stress makes you tired and anxious, or how you can finally lower your stress hormones, keep watching. And before we dive in, if this kind of health information is valuable to you, I'd really appreciate it if you hit that like button and subscribe to the channel. We drop new videos on hormones, longevity, and preventive medicine every single week. You don't want to miss them. Now, let's dive into cortisol. Your body has a natural alarm clock. And right now, at this exact moment, it's either helping you thrive or slowly destroying your health. Let me show you which one. Cortisol is a glucocorticoid hormone made in your adrenal cortex, a special layer inside your two triangular adrenal glands that sit atop your kidneys. These glands are controlled by the HPA axis, or hypothalamic pituitary adrenal axis, a communication system between your brain and your body. When cortisol is released, it binds to receptors inside your cells and modifies how your genes work. This affects virtually every tissue in your body. But cortisol isn't just about stress. It manages your blood sugar, blood pressure, metabolism, inflammation, immune system, heart function, even your memory and mood. When you encounter a challenge, say giving a speech or running from danger, your brain signals a cascade that releases cortisol. It tweaks your genes, boosts energy, lifts blood sugar, and helps you react. Here's what most people get wrong. In the short term, cortisol is your ally. It sharpens focus, boosts energy, helps you respond to challenges, and keeps you safe. This is normal and healthy. The problem isn't cortisol itself. The problem is too much for too long. Cortisol helps keep your blood pressure up in emergencies. It helps reduce inflammation and regulate your immune system. It helps mobilize fat and protein for energy if you're under threat or starving. But here's a twist. Chronic elevation, when stress doesn't go away, has serious health consequences. If you're waking up exhausted, it's not because you didn't sleep enough. It's because your cortisol isn't doing what it's supposed to do. And the crazy part, you can fix this in about 3 weeks with one simple change. Here's something most people don't know. Cortisol doesn't stay flat all day. It follows a powerful 24-hour circadian rhythm. In the morning, 30 to 45 minutes after you wake up, cortisol peaks. This is called the cortisol awakening response, and it naturally prepares your body for the day. From there, cortisol gradually declines throughout the day. While this happens, melatonin, your sleep hormone, begins to rise in the evening to help you fall asleep. Cortisol reaches the lowest levels around midnight. This rhythm helps coordinate your sleep, energy, metabolism, and immune function. But when stress becomes chronic, this rhythm breaks down. Your cortisol might stay elevated all day, flatten out, and spike at odd times. This disruption, called the blunted circadian rhythm, is one reason chronic stress leaves you feeling wired but tired, anxious, exhausted, and unable to sleep well. To learn more about melatonin or sleep hygiene, you can check out my other videos on these topics linked above. You know that feeling where you're mentally exhausted but physically can't sleep? Where your mind won't turn off but your body is dead tired? That's not anxiety. That's your cortisol rhythm completely broken. And here's the thing, most people don't even realize they're in this trap until it's too late. When you feel stress, emotional, physical, infection, or even blood sugar swings, your brain activates the HPA axis, which tells your adrenal glands, release cortisol. This is the main signal for the fight or flight response. Short bursts of cortisol keep you sharp, help you escape danger, and drive focus and energy. But here's a critical distinction. A few hours of elevated cortisol is normal. A few days, still manageable. Weeks or months, that's when problems emerge. If stress doesn't go away, think chronic work pressure, money worries, poor sleep, ongoing illness, your cortisol can stay elevated for far too long. This leads to big problems like burnout and chronic fatigue, depression and anxiety, poor sleep and brain fog, immune weakness, literally you'll be catching every cold, high blood pressure, high blood sugar, and weight gain, a disrupted circadian rhythm leading to that wired but tired feeling. Chronic stress can disrupt your cortisol's normal daily rhythm, leaving you unable to fully wake up or fully sleep. So you go to your doctor. They run a test. They say your cortisol level looks normal. And you go home thinking you are crazy, but you're not. There's a condition most doctors don't even know how to diagnose. It's called Pseudo-Cushing syndrome. And I'm about to show you exactly how to tell if you have it. So how do you know if your cortisol is too high? Symptoms include things like unusual weight gain, especially around your belly and face, thin, fragile skin that bruises easily, muscle weakness and extreme tiredness, high blood pressure and high blood sugars, mood swings, anxiety, irritability, or depression, slow wound healing and acne. In women, it can show up as irregular or absent periods. In men, they have a low sex drive. Now here's where it gets interesting. True Cushing syndrome is rare, usually caused by a tumor in the pituitary gland, the adrenal gland, or a secreting cancer. But Pseudo-Cushing syndrome is very common, and this is crucial to understand. So what is Pseudo-Cushing syndrome? Pseudo-Cushing's is when your body produces too much cortisol in response to underlying stress, illness, or metabolic problems, not because of a tumor. It's caused by HPA axis overactivation, not autonomous cortisol release. Common causes include chronic psychological stress and depression, severe anxiety or PTSD, alcoholism or substance abuse, obesity, especially visceral or belly fat, poorly controlled diabetes or metabolic syndrome, polycystic ovarian syndrome or PCOS for short, severe physical illness or surgery, and eating disorders. Here's a key difference, and this is why doctors miss it. People with Pseudo-Cushing's gain weight and show high cortisol on some tests, but their cortisol is suppressible, meaning if you give them the right medications like dexamethasone, their cortisol levels drop. In true Cushing syndrome from a tumor, cortisol stays high even after suppression. The best news, Pseudo-Cushing's is reversible. When you reduce the stress, treat the underlying conditions, or lose weight, cortisol levels normalize and the symptoms improve. Okay, so you've heard about cortisol belly, but here's what the internet got wrong. Cortisol doesn't just magically make you fat, but it does 5 very specific things to your body that make fat accumulation almost inevitable. And most do all 5 at once without even realizing it. Chronically elevated cortisol can cause your body to store extra fat, especially in your abdomen, leading to that dreaded spare tire. But it's not the only factor. Lack of sleep, poor diet, inactivity, genetics, hormones, and age all play roles. Here's how cortisol promotes belly fat, the 5 mechanisms. Mechanism 1, increased appetite. When your cortisol stays elevated, you crave sugary, fatty, high-calorie foods. Your brain craves comfort foods when stressed. This isn't weakness, it's just biology. Mechanism 2, insulin resistance. Chronically high cortisol impairs how your cells respond to insulin, causing higher blood sugar and more fat storage, particularly in your belly. This is one of the most dangerous effects because it sets you up for prediabetes and metabolic syndrome. Mechanism 3, preferential abdominal fat storage. Cortisol promotes central adiposity, which is fat storage in your visceral or belly region, which is metabolically problematic. Belly fat isn't just cosmetic, it's metabolically active and drives more inflammation. Mechanism 4, muscle breakdown. High cortisol breaks down muscle tissue for energy, lowering your metabolism and making fat gain easier. Mechanism 5, poor sleep. Stress-related sleep problems further elevate cortisol, reducing your energy, increasing mindless eating and cravings. It becomes a vicious cycle. Most people blame stress for high cortisol, but stress is only about 30% of the problem. There are 7 hidden triggers that most people don't even know about, and I'm guessing you're dealing with at least 5 of them right now. The worst part, they're compounding each other. Now you might be wondering, what actually causes cortisol to stay elevated? It's rarely just one thing. Think of it like a recipe. The more ingredients you add, the more intense the dish becomes. Let me walk you through the main culprits. Trigger number 1, chronic emotional stress. Start with stress, not just any stress, but the chronic kind. Your boss demanding deadlines, your relationship troubles, money worries that keep you up at night. These psychological and emotional stressors fire up your HPA axis day after day, keeping cortisol on high alert. Add anxiety, depression, or even past trauma like PTSD, and your nervous system becomes hypervigilant. And if you're someone perfectionism consumes, constantly pushing yourself, unable to truly relax, always worried about the next thing, that constant mental pressure is like a dimmer switch on your cortisol that never quite turns off. You can check out my playlist of videos on stress reduction techniques here. Trigger number 2, physical illness and inflammation. So here's your body. Any physical stressor cranks up cortisol. If you're fighting an infection or dealing with inflammation, your immune system calls on cortisol as backup. Surgery or major injury, your body sees that as a threat and floods cortisol to manage the response. Obesity, especially belly fat, actually produces inflammation that drives cortisol even higher. You can learn all about inflammation and the real cost of obesity with my videos linked here. And if you have poorly controlled diabetes, PCOS, thyroid disease, or other metabolic issues, your body is essentially in a state of constant metabolic stress, meaning your cortisol rarely gets a chance to relax. Trigger number 3, sleep disruption, and this is huge. If you're sleeping less than 7 hours a night, or your sleep is terrible quality, your cortisol is going to be elevated. It's non-negotiable. And if you work night shifts or travel constantly and your sleep schedule's all over the place, your circadian rhythm gets completely disrupted and cortisol loses its natural rhythm. Instead of peaking in the morning and dropping at night, it gets confused, sometimes staying high all day or spiking at the wrong times. You can check my video linked here on sleep hygiene for tips and tricks to get better rest. Trigger number 4, blood sugar dysregulation. Your diet plays a massive role too. Every time you eat something loaded with sugar or refined carbs, your blood pressure spikes and cortisol spikes with it. Do this 3, 4, or 5 times a day and cortisol is constantly elevated. Add too much caffeine, more than 400 milligrams a day, and you're basically amplifying your stress response. Too much alcohol disrupts sleep, which we already know elevates cortisol overnight. And if you skip meals or jump between diets, your body thinks you're in a famine state, which triggers cortisol to release mobilized stored energy. You can learn more about anti-inflammatory diets here, or check out Dr. Eddie's YouTube channel for comprehensive nutrition guidance. Trigger number 5, exercise overtraining. Exercise is interesting because it's a double-edged sword. Regular, moderate exercise lowers cortisol. But if you're constantly doing high-intensity workouts without giving your body time to recover, no rest days, pushing hard every single day, that's a physical stressor. Your body treats overtraining the same way it treats any other threat. It floods cortisol. On the flip side, if you're completely sedentary, sitting all day, that chronic inactivity also keeps cortisol elevated. If you need extra motivation, check out my book review on Spark. To find a good routine to start that matches your age and abilities, check out my video on starting exercise routine here. Trigger number 6, long-term steroid medications. If you're taking steroids long-term, like prednisone for an autoimmune condition, or even regular inhaled corticosteroids for asthma, you're essentially adding cortisol from the outside. This is actually the most common medication cause of Cushing's-like symptoms. Trigger number 7, environmental stressors. Extreme heat or cold stresses your body. Constant noise pollution, chaotic living situations, demanding work schedules, no work-life balance. These environmental pressures keep your nervous system in overdrive. I have 4 kids. Trust me, I'm stressed all the time. Here's what's really important. Most people don't have just one of these triggers. It's almost always a combination. You might have someone working a stressful job. That's trigger number 1. They're sleeping 6 hours a night because they're too worried to sleep. Trigger number 2. Their diet is mostly coffee and sugar because they're too busy to eat well. Triggers 3 and 4. They're trying to burn stress at the gym with intense workouts but never taking rest days. Trigger number 5. When you stack these triggers on top of each other, your cortisol doesn't just go up a little, it compounds. It's like being attacked from multiple directions at once. Your body can handle only 1 or 2 stressors, but 5, 10, that's when you really start to feel it. Here's the encouraging part. Just like these triggers stack up, lowering them also compounds. You don't have to fix everything at once. Start with 1 or 2 things, maybe better sleep and reducing caffeine. Notice how you feel, then add another, maybe managing your stress with breathing exercises, then another, cutting back on sugar. Each small win makes the next step easier. The point is you're not broken. Your cortisol isn't attacking you. Your body is just responding to the load you're putting on it. And the moment you start managing these triggers, everything starts to shift. Now here's where most people get screwed. They go to their doctor, get a morning blood test, and it comes back normal. So they think they're fine. But a morning cortisol doesn't capture your circadian rhythm and misses the whole picture. Regular morning blood cortisol tests are not helpful. I expect your cortisol levels to be elevated in the morning. To really get a clear picture of what's going on, here are the 3 approaches to use. Test number 1, late night salivary cortisol test. It's done at home, usually in the evening around 11 p.m., and it checks whether your cortisol has appropriately declined at night. Abnormal elevation then suggests hypercortisolism. This is probably the single easiest test you can do at home. Test number 2 is a 24-hour urinary free cortisol test. This one's annoying. You collect all urine over 24 hours to measure total cortisol excretion. This is the gold standard screening test for Cushing's and Pseudo-Cushing syndrome. It tells doctors exactly how much cortisol your body's producing over a full day. Test number 3, the overnight dexamethasone suppression test. You take a tablet of dexamethasone, again in the evening around 11 o'clock, Then you check your morning cortisol. If cortisol doesn't drop appropriately, that suggests autonomous or excessive HPA axis activation. There's an important diagnostic principle here. To confirm hypercortisolism, good doctors look for at least 2 abnormal test results, not just 1. This prevents false positives. Remember, your levels are supposed to be elevated in the morning. The real question is if your levels are lower at night, when it actually matters most. Okay, this is probably the section everyone skipped ahead to, and I get it. You want to know, what do I actually do about this? So at Bespoke Concierge, we focus on lifestyle first. The most common question I get about cortisol is how you can lower it naturally. This is what everyone wants to know. The good news is most of us can do it with these science-backed 7 daily habits. Protocol number 1, sleep is priority number 1. Get 7 to 9 hours of quality sleep every night. This is non-negotiable for cortisol regulation. You can check out my video on sleep hygiene to help optimize your sleep patterns. Protocol number 2, eat an anti-inflammatory, balanced diet. Focus on whole foods that stabilize blood sugar and reduce inflammation. You can learn more about anti-inflammatory diets here. To get a good understanding of how nutrition supports your health, check out Dr. Edney's YouTube channel. Protocol number 3, exercise regularly but don't overtrain. Aim for 150 to 200 minutes of moderate aerobic activity per week plus strength training. Moderate exercise like brisk walking, cycling, swimming reduces cortisol. Excessive high-intensity training without adequate recovery can increase cortisol. Include rest days. Your body needs recovery time to adapt and lower stress hormones. If you need extra motivation, check out my book review on Spark. To find a good routine to start that matches your age and abilities, check out my video on starting an exercise routine here. Protocol number 4, practice stress management and mindfulness. Find what works for you. There are several techniques that work, including deep breathing exercises, meditation, yoga or Tai Chi, journaling, and building social connections. You can check out my playlist on stress reduction here. Protocol number 5, spend time in nature. Nature exposure naturally lowers cortisol. I like to take walks outside every day. You can practice forest bathing, which is Shinrin-yoku. That means to slowly walk in nature with no agenda. Even 20 to 30 minutes outside can shift your nervous system from fight or flight to rest and digest. There's a great book on this called The Nature Fix, and you can check out my book review here. Protocol number 6, consider evidence-based supplements, but always consult your doctor first. Never start supplements without medical guidance, as they can interact with medications that you're already on. I've linked the best quality versions in the description, as well as videos explaining the benefits and dosing on each one. Magnesium helps regulate stress response and cortisol. Omega-3 fatty acids, i.e. fish oil, they reduce inflammation and cortisol. Vitamin D supports HPA axis regulation. B-complex vitamins like B6, B12, and folate support cortisol metabolism and energy. Probiotics support gut health, which affects the HPA axis. And ashwagandha, an adaptogenic herb, may reduce cortisol by about 23% after a few months, though results vary by patient. Protocol number 7, limit cortisol elevating substances. Caffeine amplifies the cortisol response to stress. Find your balance. Some people do well with 1 to 2 cups of coffee. Others should limit to morning only. You can check out my video on coffee to understand the health benefits. Alcohol disrupts sleep, which elevates overnight cortisol. I enjoy alcohol, but I'm careful about when and how much I drink. Alcohol is a friend of me. To better grasp its health effects, both good and bad, check out my video here. Last but not least is limiting sugar and refined carbs. Blood sugar spikes trigger cortisol release. You can check out my video on the glycemic index to get a better handle on how different sugars can have a huge impact. It's important to build healthy routines. Predictable routines help your nervous system feel safe and regulated, which lowers baseline cortisol. To better understand and build better habits, check out my video on habit loops here. Key takeaway, there's no single magic fix. But when you combine better sleep, stress management, exercise, and a clean diet, your cortisol will normalize and you will feel dramatically better. If lifestyle changes alone don't lower your cortisol, talk to your doctor. Sometimes medication therapy or specialist referral is needed. For those that have diabetes, hypertension, thyroid disease, PCOS, or other conditions, work with your healthcare provider to optimize treatment. These conditions drive cortisol elevation. If you need someone who takes a holistic approach and can properly manage all of these issues, you're welcome to join my practice at Bespoke Concierge MD. You now know more about cortisol than 99% of people out there. But knowledge without action is just interesting trivia. So here's what I want you to do in the next 30 days. Cortisol is your body's ultimate multitasker, crucial for survival but dangerous in excess or deficiency. In the short term, cortisol is your ally, sharpening focus and keeping you safe. But when chronic stress keeps cortisol elevated for weeks or months, it disrupts your sleep, metabolism, mood, and immune system. The good news? Cortisol problems are highly treatable and reversible. Understanding your triggers, whether psychological stress, poor sleep, diet, overtraining, or medical conditions, gives you back control. Proper testing can confirm if your cortisol is genuinely elevated. By prioritizing sleep, managing stress, eating well, exercising appropriately, spending time in nature, and addressing underlying health issues, you can restore your cortisol to a healthy rhythm and reclaim your energy, mood, and health. The transformation doesn't happen overnight, but when it works, people describe it as getting their life back. They wake up refreshed instead of exhausted. They feel motivated to tackle projects they've been putting off for years. Their relationships improve because they're present and engaged again. They rediscover the energy and drive that made them who they are. Your cortisol health is too important to leave to guesswork or random internet advice. If you're dealing with chronic fatigue, unexplained anxiety, weight gain, or just want to take control of your stress response from the inside out, you're welcome to join my practice at Bespoke Concierge MD. We're here to help nationwide, offering personalized cortisol optimization programs that use comprehensive testing, salivary, urinary, and suppression tests, along with evidence-based lifestyle protocols and one-on-one support. We treat you as an individual, not a number, because your cortisol patterns and triggers are as unique as you are. Whether you're looking to optimize your cortisol rhythm, prevent burnout and chronic disease, or finally get answers to symptoms you've been dealing with for years, we're here to guide you every step of the way. From testing to personalized nutrition and stress management plans to ongoing monitoring adjustments, we make cortisol health simple, science-backed, and sustainable. Thanks for watching. If this information helped you or someone you know, please share this video. Your story in the comments could help others realize they're not alone in their cortisol struggle. Remember, your cortisol isn't broken. It just needs the right balance, sleep, stress management, and support. And that balance is possible when you have the right tools, support, and personalized guidance. Don't waste another day feeling exhausted and overwhelmed. Take the first step today by picking one of the 7 protocols we discussed. Maybe it's better sleep, or cutting back on caffeine, or a 20-minute walk in nature. Small wins compound. Let's work together to help you feel like yourself again, energized, focused, and in control.